Hello, everyone. Welcome back to another episode of Testimony Thursdays. I'm your host, Dr. Jazz. And as you know, Testimony Thursdays is where we share our God given talents and talk about different miracles we've experienced and talk about our testimonies so we can share it to inspire others. So, we're going to go ahead and get started. As you can see, I am recording again at night. Last minute jazz for the win. Here I go. So, let's start with our scripture. This is from John 15:10 through 17. If you keep my commandments, you will abide in my love, just as I have kept my Father's commandments and abide in his love. These things I have spoken to you, that my joy may remain in you, and your joy may be full. This is my commandment, that you love one another as I have loved you. Greater love has no one than this, than to lay down one's life for his friends. You are my friends if you do whatever I command. No longer do I call you servants, for a servant does not know what his master is doing. But I have called you friends, for all things that I heard from my Father I have made known to you. You did not choose me, but I chose you and appointed you that you should go and bear fruit, and that your fruit should remain, that whatever you ask the Father in my name, he may give you. These things I command you, that you love one another. So, y'all, as you can see, I have on my faith shirt. I got this from my friend Jay. I love her so much. Thank you for the shirt. It's so cozy. But yeah, powerful scripture. I just finished Bible study tonight, so I thought I was going to talk about something else today, but we may still get into it. But I just wanted to talk about that really quick and about how the pattern has been just talking about God and keeping his commandments, loving one another, love your neighbor as you do yourself. And I just feel like I was just talking to my friends about how, like, for me, it's a struggle to fast. And like fasting, anything that God commands us to do is not going to harm us. Like, it's going to benefit us and it's going to give him the glory. It's going to be for our good, for his glory. So I'm like, fasting, studies have shown, like, we're going to put the biblical and the scriptures to the side and we're going to go to the straight research. And, studies have shown that if you can fast for like 2 weeks, like even like What the Health, the documentary, if you can just do a Daniel's fast, only eating like a plant-based diet for 2 weeks, you are more than likely to reverse type 2 diabetes, to help lower your blood pressure, lower your cholesterol, like everything that's bad for us. And it's like, fasting is it's challenging and it's like really hard for me to do. But once again, it's to, better myself and just really, quiet down my flesh. It's like we're feeding our flesh at least 3 times a day. Now, for me, it might be a little bit more because sometimes I be hungry. But it's like, how many times do we feed our spirit? You know what I mean? Like, how many times are we in our word? Are we, with a faith-based community? We're talking about God. We're talking about Jesus. We're in our quiet place, in our quiet time. How many times are we doing that? So yeah, that has just been the theme for this week, y'all. So I definitely want to get serious about like living a fasting lifestyle. So that's something that I'm going to be working on the next couple of weeks. But I love a chocolate chip cookie, and that's my problem. Um, so yeah, I just wanted to talk about that, and I really wanted to talk about like the home health, physical therapy as well, because the previous episode, if you haven't listened to it, go check it out. But it is me discussing how I became like a virtual pediatric physical therapist and all of the work that I do with that. So this episode, I wanted to like dedicate it to talking about home health physical therapy. And today was a day, y'all. Today was a day. Oh my goodness. It's always something. And honestly, I would say, I was talking about this earlier with one of my patients. I was saying how like I feel like at least 90% of my caseload like are angels. Like everyone's so nice. Like, and I'm pretty sure it's the culture in Hawaii. Like people are just really, really nice. They really truly believe in like the aloha spirit. And of course, you have, people with evil spirits everywhere, But I feel like here majority of the people are like very, very like nice. Um so yeah, it's a bunch of things I want to talk about, like just the culture and then like the treatment sessions and my schedule and all that stuff. So let me start off with the culture. So to me, I would say one thing that was definitely like a culture shock is that like people don't wear shoes here. Like it's very rare that somebody has like sneakers. Like they usually wear what they call slippers, like slippers, but it's like some flip-flops. So I feel like when we're doing gait training, sometimes it can be hard because especially like if I'm recommending orthotic, it's like where are you going to put that orthotic in a slipper? So I feel like that was like a culture shock for me. And then also the less melanated people, it's also a struggle for them here. And I just find that so wild. And I have to continue to do my research with the history and everything. Um, but I'm pretty sure it's because of colonization. That's usually what happens. But they have a term where they call the less melanated people, the white people, they call them haole. And a lot of local people here, people that have been here for a long time, like feel some type of way like against like white people. So just I mean, y'all, it's very, very common. Just I'm gonna tell you two examples from last week, literally from last week. So I did, and we're gonna break down some terms for home health, but I did a starter care, and basically a starter care is when you do the initial assessment for the intake for the patient. So this is like they're fresh out the hospital. Like I've done a starter care where they came home from the hospital that same day, and like I went in and did a starter care or a resumption of care. But basically, yeah, you get all the documents signed, you get the consent, you get like you go over their medications with them, like you do all these things. So I was doing it. I'll break it down a little bit more later, but I was doing a starter care, and this lady, like before, now I learned before I do a starter care, like I always call before I drive to go see them because I was supposed to do a starter care one time, and the patient wasn't feeling well, and she was like I didn't have her number to call to cancel. So yeah, and I get paid per point, so we'll go over that too. But so I call and I'm like, hey, I'm talking to like the caregiver, which is it was her daughter. I was like, hey, I'm coming to see so and so in about 30 minutes. Just want to give you a heads up, blah blah blah. And she was like, okay, yeah, see you there. My mom's home alone, but she will leave the door unlocked or whatever because she couldn't like get up to go open the door. So I was like, okay. So then I go in there and I'm like talking to her and stuff and like just going over like the all the paperwork and everything. And she was like, she was so funny. What did she say? She was like, yeah. She was like, yeah, my daughter said you were very nice over the phone. Like she thought you were a local person. And I was like, oh no, thank you. I was like, I'm from South Carolina. But thank you, I appreciate it. And she was like, yeah. She was like, she said something along the lines like, I'm glad you were like Howley. And it's wow because her ex-husband is like a white man. I mean her she's a widow. Her husband passed away. And yeah, and I'm like, what? And she just was like, when I say they don't play, yeah, they don't play about Howley people. So, and every time I say, then, okay, we got something to talk about, y'all. We got something to talk about. Okay. Then, so that happened. Then, last week, I was covering for one of the other physical therapists, and I met this lady before when I was doing my training with my preceptor when I first got hired on. And she was like, yeah, they sent a Howley man out here the other time to come see me when the other PT wasn't available. And she was like, no, I requested no more Howley people. And I was like, what? Like this lady, like they are very, very, yeah, yeah. So that happened. Then this one patient I was seeing, she's a white lady, and her daughter is a nurse at one of the hospitals here. And she was like, yeah, like I've had people request not to work with me because I'm Howley. And I'm like, that's wild. Then we had a meeting at work a couple months ago, and they were just talking about how they basically like prep the white people and say, hey, like, if you're going to some of these homes, and like Hawaii is considered like rural, and there's some areas where it's like not a lot of habitation and not a lot of things around, like very, very rural in some areas here. So they're like, always be careful when you go to those areas, because yeah, a lot of those people have been here for years and they still have like some of those same beliefs and things, just um mindsets that are hard to change and stuff. And yeah, so they talked about that at a meeting, and one of the physical therapists, she was just talking about how, a little bit about the history, but I still have to do more research for myself. But she was saying how, like, basically the Portuguese were coming over here, and they were like the slave owners to the Hawaiians. So that's kind of where it, in like the Filipinos too, and that's kind of where it kind of happened, and how they just weren't treated the best. And yeah, this is the result of it. So my patient with the daughter that is a nurse, she was like, yeah, and this is not the first time I've heard this as well from white people here, but she was like, yeah, being called Howley is like being called the N-word. And I'm like, in my head, I'm like, no, it's not, because one, y'all was not enslaved. Like, that's not even, no. I was like, in my head, I said, being called Hallie is like being called the C word, but I didn't say that out loud. And y'all know which word I'm talking about. But I'm like, that's the equivalent. It's not equivalent to being like oppressed. You were literally, not you, but people who looked like you were oppressing people in, I don't know what that even, I don't even know what Howley means, but what the term, means. I just know it means white people. But I'm like, what? And yeah, so that's a whole thing. So that's something to look out for. But I feel like, other than that, some nice people out here, they funny. They really, really funny. And I would say the language and the culture is different. So even for me, like, I have a lot of Asian clients. So I try to speak their language, when I first walk into the visit. So I already forgot a lot of them speak Ilocano and Tagalog, and I already forgot how to say hello in those languages. But a lot of I have this one patient who has dementia, and she speaks Korean, mostly Korean. Oh, this is a funny story too. Oh my gosh. Okay, so she speaks mostly Korean, and I listen to, like, when I'm driving, I'll listen to how to say hi in their language. So when I get there, I try to already, like, have it in my head. So as soon as I walk in the door, I'll say it. So how you say hello in Korean is Annyeong Haseo. Annyeong Haseo. Oh, that sounds good. Look at me. Look at me. Duolingo. Oh my gosh. Annyeong Haseo. So I was practicing that. So as soon as I walked in, I said it to her. And once again, it was like a starter care, the initial visit. So I have a physical therapy assistant. I'm paired with one. And she was like doing the follow up visits and stuff, was seeing her. So I just went back in, like, I think that was last week as well. And I did like a reassessment just to see how things are going, supervisory visit. And she's so cute, y'all. She was like looking at my skin, and she was like, wow, like, you're not even burnt. And I was like, what? And her daughter was like, what are you talking about? And she was like, your skin is so soft, like you don't have sunburn. And her daughter was like, oh, like, she thinks that you have a tan, like she doesn't know that you're black. And I was like, oh. So I told her, I was like, and she's hard of hearing. So I'm literally yelling, and I'm like, I'm just gonna call her Miss Nancy. That's not her name. But I was like, Miss Nancy, I'm black. And she was like, what? And I was like, I'm black. And she was like, huh? And I was like, I'm African American. And her daughter was like, I don't even know if she knows black people, because she grew up in Korea, and then she came here, and then, like, her daughter was like, she just hasn't been around a lot of black people. Like, I don't even know if she knows what that means. So I'm yelling again, and I'm like, Miss Nancy, do you know Black people? And she was like, yeah. And I was like, okay. So it was just funny. Um, it's always cute to get like and not cute because I know this is like a serious and challenging diagnosis, but the people who are pleasantly confused are very, very fun to work with. I have another client who is pleasantly confused, and the whole session he was just like, "You're just nice, like you're just a nice person." He's like, "What's your name again?" "You're just nice," and I'm like, "Thank you, thank you." Oh my goodness! And then I had another patient when I was doing skilled nursing, at working at a skilled nursing facility, and she had dementia. And every time I would come in and out the room, she would say, "You're just so beautiful." And I was like, "Me?" So I'm like, "Okay, let me go get a gate belt. I'll be back." And I walk in, she's like, "You're just beautiful." And I'm like, "Okay, I'll be back. Let me go get a walker." And I come back. But yeah, she was just nice. That's how my grandma was too. Like she was like very, very, very pleasant. Like always been a nice person, but once she developed like cognitive impairments and she couldn't remember anyone, like she was always like nice. And I feel like for me, if I couldn't remember people and there was somebody always like staring at me, I feel like I would have an attitude because I would be like, "Who are you?" You know. So shout out to my grandma, I love her. Um, so yeah, back to home health. I just have the funniest stories, y'all. I have the funniest stories. Like y'all would not even believe some of the things that people have said, and it's just a lot. So yeah, so you got to start a care. I like doing starter cares because once again, I get paid per point. So with my company, like a starter care is 2.5 points. So it's a lot of income that you're bringing in, and you're only seeing like one patient. So for me, it's fun. It's fun to get the visit started. It's fun to be like that case management role where like you're figuring out like, do they need OT? Do they need speech? Do they need to go back to the hospital? Do you need to call 911? That's another thing too. Like home health is all fun and games until you have to call 911. Like, cause then it's life or death. And it's like, what is literally going on right now? So I feel like, definitely being like a home health clinician, I feel like I definitely like use my doctorate degree way more because you have to know when to refer. You have to know how to check vitals. Like we just had a skills check where we went into the office and we reviewed how to do like lung auscultation. I just did my CPR training again. We learned how to take out like sutures, staples, and just heart rate and what do you do if you don't feel the pulse on the radial pulse, and it's a lot. Like, so yeah, I would say definitely don't, I wouldn't say don't, but be cautious like trying to go into home health if you're not comfortable with those skills, because yeah, you never know like when somebody's going to collapse. And then you got to know if they're DNR. And that's another thing too. So with the starter cares, like you're getting all this information and you're getting their advanced directives. Before I was a home health clinician, I did not know what an advanced directive was. Like I didn't even know like a medical power of attorney, any of those things. So now that I do that, like I ask that question like all the time now. I'm like, because you can get a post form, it's a green form, and it basically states like their um if they want like life-saving measures, like if they want CPR or if they're DNR. And I believe POST stands for physician ordered life sustaining treatment. So yeah, so that's what I ask people when I go into the homes. I'm like, hey, do you have an advanced directive? Do you have a surrogate decision maker, someone to like make your decisions if you're incapacitated? So when I went home the last time, like back to South Carolina, I asked my parents, I said, do y'all have an advanced directive? And they were like, no, why are you asking us that? Like, we're still young. And I'm like, okay, I'm just wondering. And, I'm asking everybody else, parents, that, like, what do we need to get on this? Sign here. Um, so yeah, that's that. So you got to start a care. Then you can do like, regular visits, regular treatment visits, which it's not that much money, and we can work together as a team. Like we have assistants, so and that's they can only do daily visits. So I try to definitely pass daily visits over to my assistant, And then what else? We'll have like discharges. We'll have, I talked about like supervisory visits where you have to go in every couple of weeks. And then we'll have like resumption of care. So they just got out the hospital. Like, let's say you see them. I usually see people for like, lately it's been a lot of like flu, pneumonia, and heart failure. Heart failure is like so common. I'm like, oh my goodness. So let's say a client has heart failure and I go in and I do the starter care. And then let's say we see them for like 2 weeks, and then those 2 weeks go by and they're not feeling well and they have an exacerbation. So with that, they would have to go back into the hospital. Let's say it was hard to breathe, maybe they have to get a thoracocentesis or something just to get the fluid out. And let's say they come back home in like 2 days. So then you have to do a resumption of care where you have to just get more paperwork and documentation and redo like the evaluation and all of that stuff, call the doctor and all that. So that's what that is. Then you can also do like what we call like a recert. So that is when you're seeing a patient and they would benefit from like more therapy. So let's say you finish like the episode of care, and the episode of care, I usually see people for like 2 months. Like that's usually how long we see them for. And sometimes in that 2 months they're doing great. Like, you might go in the first day, and this is what I love. I love when I go in for the first visit and the client is not feeling well. And you can just tell like they're just so miserable. They just got out the hospital, they're just not feeling well. And then when you go and you start talking to them and you get all the information and you get them moving and just being energetic. Like people can tell that I do pediatrics too, because I'm always like so just so bubbly. So I love when you go in, they're just miserable. And then by the time you leave, they're like, you know what? I feel better. And I love that because it's like a lot of people, what I'm learning too, need community. That's number one. Like a lot of people just don't have like people to talk to, a support system, friends. Um, and you will be surprised too. A lot of married couples like do not talk to each other. Like I wish I could do a survey and just like tally how many people have said to me like, it's not funny, but we only talk when you're here. Like we only have fun when you come. Like when you leave, we don't need to talk to each other. And I'm like, that is terrible, but that's that. So I forgot where I was. Oh, so a research. So you have different things where you can get like paid more money if you do a certain type of visit. So for me, started care me all day because it's more money and you can still like help people and you really can get the ball rolling on a lot of things that people need. Because I try to be on top of it. Like I need to update my to-do list, but I definitely try to, like if I know somebody needs like a Hoyer lift or a wheelchair. Like I try to get all that documented and like make sure I'm very thorough so there's no questions. Like we can get it approved by insurance and all that stuff. So yeah, that's that. But yeah, the culture has definitely surprised me. Even with how nice people are too. Like I go into like a senior living place and one of my clients, she keeps her door open like the whole time. And I was training somebody and she was like, is that her place? I was like, yeah, we can just walk on in. And she's like, what? And I'm like, yeah. And then when we left, she's like, do you want us to shut your door? And I was like, no, she don't shut her door. Mm-mm. And that was just that, like a lot of people, leave their door unlocked and stuff. But yeah, that's that. Home health. Home health is a vibe. I've said it before and I'll say it again. My only regret is not doing it sooner. But once again, I know I'm privileged because I live in Hawaii. So I don't, there's a lot of nice people here. So I don't have to run into a lot of negative things and all that. But I mean, still you have people who are hoarders. I've had a client tell me, there's a mouse in the house and he's been up all night because the mouse is running around and all this and that. And I'm like, I would have kept that to myself. Like, I'm not trying to hear that, sir, but, and yeah, it can be the pros is definitely the weekly pay. My company gives out a lot of bonuses. I would say the interprofessional collaboration is good as well because if you're like the PT, but they also need OT or like speech, like you can definitely social work, you can recommend those things. Another thing too, we just started not partnering, but we had a meeting with one of these companies that does outpatient physical therapy, but it's mobile. So they can go to the homes and see the patients, which is great because sometimes when we discharge people, it's like you have to be homebound. Like you can't be like, hey, I'm going out to eat with my friend every day and we're gonna walk like to and from the restaurant without an assisted device. It's like, okay, you're not you're not homebound, so we can't legally come in here and have insurance pay for this. Like for Medicare, for Medicare Part A, I believe, and then for Medicare Part B, don't quote me on that, but there is a part with Medicare where you can do like outpatient PT and go see the patient in their home. So a lot of my patients, they don't drive anymore, but they would still benefit from more therapy, just to help them a little bit with their balance or um, their endurance, like something just to give them another boost. So, or like I have one patient that she just got an AFO and it took her forever to get it, but she needs more gait training so she can normalize her gait pattern. And she's very, very close to reaching that goal. It's just, I've been seeing her for like half a year now. And I'm like, we can't continue because no longer homebound. But yeah, so it's a lot of fun. It's a lot of fun working in home health. It's a lot of good stories. Like I said, the pay is amazing. The cons, you have to be on it. Like you really have to be able to like have those medical skills where you're able to assess vitals, when to call the doctor, how to do CPR, how to communicate with people because you're gonna bump into people that you know aren't going to follow any of your instructions and it's going to be dangerous. And you're like, what in the world? They're not going to use an assistive device. They're not going to ask for help. And unfortunately, you get falls and burns and all of these things. So, yeah, that was that. All right, y'all, let me get ready to go to bed. But let's end the episode with what is a test? What is a test? What is a test that led to a testimony? I would say I'm still in the midst of it. So I would say, definitely for Lent, like I want to eat healthy. I'm gonna go ahead and say that. So just keeping God's commandments. That's what our Bible study was about tonight. And then last Sunday at church, our sermon was about keeping your peace. And how you keep your peace is like stay focused on Jesus. Like it's a lot going on in the world right now. It's a lot going on, and like I said, like I'm very privileged from living in Hawaii and just being able to go to the beach when I want to and just being able to decompress that way. But yeah, I'm going to do a better job at keeping God's commandments because it's for my good and it's for his glory. And just that's going to help me keep my peace. So thank y'all for listening to another episode of Testimony Thursdays. Like, comment, subscribe, DM me. I love when y'all say like, I enjoyed hearing your testimony. Thank you for sharing. I really, really love when y'all say that to me because it makes me feel good. And it's confirmation that, people are listening. So like, comment, share, subscribe, and I will see you all next Thursday.